Ready?
Ready.
Okay, so we'll start a sequence. We numbered these 1, 2, 3, 4, and then chamber will be number 5. So switch on the back of these. Don't touch the black dial, leave it set to number 2. Just power up with a switch at the beginning of the day, power down with a switch at the end of the day. Okay. So now both those are on, and then we have compressor number 2. Oxygen concentrators number 3. Red switches to the right to number 1. Air chiller number 4. Black switch on the back. And then hit run. This is your set value on the bottom. 14.5 is good. Condensation risk below 11.5 inside the chamber. So try to keep it at 14.5, 13.5, and then this value will eventually match your set value, and that will be the temperature of the water circulating in the chamber. Okay. Chamber switch stays on in the back. Tablet is on. You can see loading down here, but we'll power it off. Act like it's not on. Switch in the back, hold it for 5 seconds. It's gonna boot on eventually. If not, touch it again. And then same thing with the tablet inside. I think the switch is on the lower left side. That tablet with a fully kiosk browser. If you're driving the chamber from the inside, if you're using the tablet for entertainment, then you can just power it on and then select whatever app you're using for entertainment. So this is going to auto boot into fully kiosk browser. The chamber emits its own Wi-Fi, so this tablet's going to connect to that chamber Wi-Fi. If you connect to a different Wi-Fi, then it's going to not properly boot the chamber control software.
Does that need to go off every single day?
Yeah, I would power everything down on the back when you're done. So this would be number 5. You'll power it down, power that down, and then 3, 2, 1. So you will need to touch this screen to get into your session page. You'll see your client, patient at the top. You'll come in here, you'll select a protocol. You'll see selected protocol, active protocol. You'll activate your protocol, and then you'll see active protocol at the top. Session. All the controls over here are pretty intuitive. You have alarm reset at the top. If you do have an alarm triggered from like the emergency decompression or anything like that, you want to clear that alarm in order to operate the software. Okay, and then enable intercom, push to talk on the outside. The mic is over here, and the speaker is also over on this side. And then it's open mic on the inside when you have enable intercom. So they're talking out loud, and you should be able to hear them from the speaker. Okay, so the door is fully shut and seated. And now, push to talk, door shut. Are you guys ready to start compressing? I'm going to lock the door. Door is locked. I think the compressor's closed right now. It's okay. Saw that door didn't close because the compressor was closed at the time. Alright, so we're gonna go ahead and unlock the door one more time. Lock it again. Alright, you wait until you don't hear the door hissing anymore, and then press play. Disable the intercom. And then compress it at safe speed. So you have your time here. And safe is 10 kPa per minute. They're doing good. Their ears are clearing. You say, hey, are your ears clearing? Good. If your ears aren't clearing, please knock on the acrylic and I will pause compression. Or speak out loud if you have the walkie-talkies, you have the intercom and it's working well. So we've surpassed 10 kPa per minute. I'm gonna pause it, especially for the first session. If you know your clients well, you know they're gonna clear their ears. Then there's really, that's kind of on the technician at that point. So 10 kPa, we're at a minute, continue compression. And we can see our set pressure here, 60. This is gonna go to 60. It's gonna be 10 minutes. So it's gonna run that first step for 10 minutes on oxygen, okay? Give your oxygen percentage inside the chamber, monitoring that interior atmosphere for contamination, which the contamination point would be 23.5 in the US. It's different for every country. So you have your lighting. Do they want lighting on? Do they want to relax? You have your cooler. Hey, are you guys hot? Okay, I'm going to turn the cooler on for you. Okay, you have your ventilation. So it's going to stop compressing and start ventilating the chamber, and it'll be different speeds. Okay, so we've hit our 20. It's 2 minutes. That timer is going to keep running, so that's not a true 10 to 10 or 1 to 10. Okay, are your ears? How are you feeling? Are your ears clear? Okay, let's keep compressing. Safety checks once every 10 minutes, but during compression and decompression, you definitely want to be here at the controls.
Okay.
It's not a good idea to really stare at them, but you do want to have like a visual reference so you can see their face.
Okay.
Okay. But then again, you know your clients, you know they're going to be okay. You don't have to like stand there and look at them the whole time. What else? I think that's it for chamber operations. Okay, so we'll go over, let's just say that, hey, I want to come out early. We'll go ahead and pause. Yes. All right. We'll pause you, and then I'm going to decompress you with a manual valve. Please don't hit the emergency stop. Okay, we'll come over here. You can hear it right away, but kind of like that. And then you're here. You're watching this, you have the timer. And you just decompress them nice and slow. You'll be out of the chamber shortly. We're going to decompress you at a safe speed. And then it's always, if you're having trouble breathing, just take off the mask and breathe normally. Breathe normally in the mask. It's difficult to exhale with less pressure in the chamber. So if you want to put the mask on when we get the pressure, it'll be a little easier to exhale at that point. But it does take some getting used to because you're not really ever using muscle to push out your breath. So that's unnatural, and that'll just take some getting used to, like 1, 2 sessions. Okay, grab a little more. If you do open that all the way, it does get extremely loud, and that can damage your ears. Okay, so you always have the ability to say, hey, they're knocking, they're in pain. Okay, I want to pause your decompression. Or I'm just gonna close that and leave you in pause. Okay. All right, are your ears okay? Is your ears clear? Yes, no. Okay, you can have like plastic bottle of water in there, and sipping water can help. Try to keep like gum and food out of the chamber because you don't have hands on. So if they were to choke on whatever's in their mouth, then you couldn't get to them right away. And then it can also obstruct their airway, which isn't good on decompression. So bottle of water, plastic. On decompression, it is going to build pressure, so you want to have them like release the top periodically. Metal water bottles can, bend and change shapes. You want to keep it plastic, kind of like a vented water bottle situation. That can help on compression and decompression, but keep in mind that they're also might need to use the bathroom if they're drinking water. So I haven't used the bathroom before. If you guys are like treating elderly patients, you have the option to bring a urinal in there if you do want to get them through that session. If it's an issue for them, some people are just more comfortable having a urinal. But then you want to put like a sheet over the chamber and acrylic. So that's just an option from my experience. Or I really gotta go. Okay, we'll decompress anything. Alright. Stop. Their ears are keep going. The biggest thing is patient comfortability. You want them cool. You want their ears comfortable. If they're cold, maybe a blanket. When I worked at Rocky Mountain, we would send people in with ice packs if they got hot. So you kind of learn that on an individual basis. This person gets really hot every time I compression. It doesn't matter if the air chiller's on or what. And then you have a clay ice pack, and then that can help a lot. Some people bring like 2 or 3 ice packs. Alright. So we're going to let this fully depressurize. Okay, so the door's not opening. It's because we're paused. So I'm either I'm going to hit play, and I'm going to hit stop. Okay? Valve's still open. Shut that. For your next session, we're going to power off. Try to keep this closed at night. Just keep bugs or dust out of there. It's always a good idea. There is sunlight hitting on the acrylic, so it's a good cover. Sunlight on this. When the chamber's not in use. Hit stop, wait for this light to stop flashing, cycle through. it's gonna stop flashing. Then it's gonna turn this off. Okay. And then this stuff. Switch to the left. Switch to the left. This is a little hot, so we're just gonna let it run just to keep these fans moving.
Okay.
It'll cool down. And then 2 and then 1 at the end of the day. Alright.
Sweet.